Good afternoon, everyone, and welcome to the Center for Migration Studies webinar, Mapping Key Determinants of Immigrants' Health in Brooklyn and Queens. Last week, CMS released a report with the same title, as well as a new data tool that maps health determinants for immigrant communities in Brooklyn, Queens, Manhattan, and the Bronx. So without further ado, I'll turn it over to the moderator of this panel, Father Patrick Keating.
Good afternoon, and it's an honor for me to join all of you and to be part of a very historic and important moment, and I'm grateful for the Center for Migration Studies for this report. We are privileged today to have the two key people behind the report, and I'll be introducing those in a moment. But just to let, in case this is your first time, to give you a little bit about the Center for Migration Studies of New York. CMS is basically a think tank educational institution devoted to the study of international migration, the promotion and understanding between immigrants and the receiving communities, and to public policies and safeguarding the dignity and right of migrants, refugees, and newcomers. It was founded or established in 1964 and incorporated in 1969. So for over 50 years, this very important organization has been putting out reports, as you're going to hear about today, and tools that have a very practical and very beneficial and timely, I might add, particularly with this report that was put together by the Center for Migration Studies. I'd like to briefly just introduce the panelists that will be doing most of the speaking today. You hopefully won't hear too much of me. First, I'd like to introduce Vicki Virgin, a consultant to the Center for Migration Studies. Vicki currently is a research consultant. She has an extensive resume, and for over 20 years, she worked as a demographic analysis for the New York City Department of City Planning. She holds the BS in economics from the University of Utah, and her, along with Robert Warren, who's a senior visiting fellow for the Center for Migrant Studies, put together this extraordinary report. Mr. Warren has served 34 years with the United States Census Bureau and is a formerly the Immigration Naturalization Services. Mr. Warren has testified before Congress, and he has a Bachelor's of Science and a Master's of Science in Education from Indiana University. And lastly, but definitely not least, from the Center for Migration Studies is Daniela Alima, the Director of Programs. She is the Director at the Center for Migration Studies. She, in 2015, received her Master's of Science from the Urban Policy and Analysis Management Program from the New School. And so first, in a few moments, you'll hear from both from Vicki and from Bob regarding their report, and later on, a very inciting and important tool from the Center for Migration Studies from Daniela. Now I'd like to turn it over to Vicki Virgin.
Hi, everyone, and thanks for joining. I have next to me Bob Warren, as you just heard, my co-author, and he's going to be chiming in from time to time. So I want to begin by setting the stage and just show a couple of slides on the two boroughs that we're going to be talking about today, Brooklyn and Queens. Next slide, please. Brooklyn is the borough with the largest population in the city, with 2.6 million people. Brooklyn's famous bragging rights is that if they were their own city, they'd be the fourth largest in the US. Queens is close behind with 2.3 million. Queens, even though it's smaller, has smaller population than Brooklyn, it has the largest foreign-born population. 1.1 million foreign-born reside in this borough, and they make up almost half of the population. Brooklyn has almost 1 million. It's just under, but it's pushing, and that represents 37% of that borough's foreign-born population. So this slide shows the population of the two boroughs by citizenship status. Everything that's not blue represents the foreign-born, which is the focus of this report. Within the foreign-born, it's often divided between naturalized citizens, which is the orange slice, and the remaining, which is non-citizens. Non-citizens are further disaggregated into legal non-citizens, which are green card holders and other legal statuses such as non-immigrants, and then the undocumented immigrants represented in the yellow slice. And you can see that Queens has a slightly larger proportion of undocumented immigrants than Brooklyn. So many studies address immigrants as a homogeneous group, but we find that it's really important to delineate this population by legal status because they are different groups with very different needs. Next slide. Next slide, please. So this chart illustrates the remarkable diversity of immigrants coming from different regions of the world for both boroughs. Queens, on the right, is often cited as the most diverse county in the country. It's home to immigrants from over 160 countries. It is also home to one of the fastest growing groups in recent years, Asians. Almost 1/2 of all Asian immigrants living in New York City live in Queens. Queens also has a larger share of immigrants from Latin America, the Dominican Republic, primarily Colombia, Ecuador, and countries from Central America. Turning to Brooklyn, on the left, you can see that the shares are more evenly divided. Immigrants from Asia, Europe, and the Caribbean North non-Hispanic contribute between 23 and 30% to Brooklyn's foreign-born population. Immigrants from the West Indies, categorized here as the Caribbean non-Hispanic, are much more likely to settle in Brooklyn. In fact, Brooklyn is home to one of the largest populations of West Indians outside the West Indies. So while Brooklyn does not have the largest share or number of immigrants, it is arguably as diverse as Queens. Next slide, please. In this next section, I briefly talk about the methodology and data sources that we used. So we started by doing an extensive literature survey, and then we studied health indicators published in reports such as the National Center for Health Statistics, the county health rankings, and closer to home, New York City's community health profiles. Common indicators emerged, the most salient being health insurance, educational attainment, poverty, and housing conditions. Others included neighborhood conditions, self-reported health, homicide, mortality, and teen pregnancy rates. Next slide, please. We then examined many data sources, such as administrative data from the New York City's Department of Health. We also looked at the survey that they do, the Community Health Survey. However, it was difficult to find data sources that provided information not only on citizenship or immigration status, but also at the geography that we needed, community districts. As a result, many commonly cited health determinants could not be used in this study. So Bob's going to talk to us about the data source that we used.
Yeah, I wanted to do two things here. I wanted to point out how important it is to compile health data by legal status. For example, if you looked at the Community Health Survey and you looked at, let's say, Sunset Park and Windsor Terrace, which is one of our leading CDs for possible health problems. I'm not sure how to say that. If you were to look at that CD and look at the Community Health Survey, you would see that for that CD, the unemployment rate, the self-reported health, hospitalizations, infant mortality, premature deaths, all of those things in that CD, they would be doing better than the entire borough of Brooklyn. But that's one of our most at-risk CDs. So it was really important to sort out the data, not only by legal status, but especially to look at legal non-immigrants, legal non-citizens, and undocumented. So we were able to compile all of that data from the American Community Survey, which surveys places down to this community district level. And we used data from the American Community Survey that's put together for a 5-year period. So in every single CD in New York City, the sample was about 600 or more interviews for every CD. we were able to sort out the non-citizen population into legal and undocumented using techniques that we've developed over the last few years at Center for Migration Studies. We have reports on that, and for that methodology, you can refer to our reports. So essentially, it was important to get down to the CD level by legal status, and we were able to use the American Community Survey to do that.
So the health determinants that we landed on were health insurance coverage, less than a high school education, below poverty, extremely overcrowded housing conditions, that's defined as more than 1.5 persons per room, limited English proficiency or LEP, and undocumented immigrant status. The analysis of these determinants is supplemented by other ACS data, such as essential workers, number of persons in mixed status households, years spent in the US, country of birth, and languages spoken. Next slide, please. These indicators were then compiled and analyzed for each CD and ranked from the highest to the lowest. CDs that ranked the highest are neighborhoods with residents that were most at risk of adverse health outcomes. For example, CDs with higher poverty rates would rank higher than those with lower poverty rates. A final ranking was produced by summing the indicators across each CD. Key findings reveal that naturalized citizens, as Bob was just talking about, naturalized citizens have health profiles that are more similar to the US native born than to non-citizens. And this was also supported by the literature that we read. Health insurance, the second key finding, is a really important health indicator, and it affects about half of the undocumented population. It's important to note here that undocumented immigrants cannot purchase health insurance on the health insurance marketplace, and with few exceptions are not eligible for Medicaid. So this indicator plays a very important role in our study. Health determinants are highly correlated, we found. For example, neighborhoods with large shares of persons without high school degrees were also more likely to have large numbers who had trouble speaking English. Commonly used health indicators for the general population, such as homicide rate, were not applicable to immigrants, as homicide rates for immigrants were quite low compared to that of the citizen population. And lastly, undocumented immigrants are much more likely to be working on the front line in this COVID-19. Next slide, please. We didn't include essential workers as a key health determinant, however, because we're hoping that it's somewhat temporary, but it did inform much of our research. This slide presents the top neighborhoods for undocumented essential workers. The percent of essential workers for non-citizens and the native born are also shown for comparison. 80% or more of undocumented workers in these 7 neighborhoods were employed in essential services. Elmhurst and South Corona in Queens and Bensonhurst Bay Ridge in Brooklyn had almost 90% of their undocumented worker population working as essential workers. And 4 of these neighborhoods we will find to be among those most at risk of adverse health outcomes. Next slide, please. After analyzing the data, we made the decision to focus our research on non-citizens. One of the key findings already spoken about here is that naturalized citizens definitely have characteristics that look more like the US born than non-citizens. Naturalized citizens also make up over 1/2 of the total foreign-born population. Therefore, to combine them with non-citizens would skew our findings. This chart supports our reasoning. On the far right is health insurance by the different legal statuses. You can see that the uninsured rate for citizens, both native born and naturalized citizens, is roughly 5%, compared to 25% for total non-citizens, and in particular, 47% for undocumented immigrants. For extremely overcrowded housing, we find that citizens, both naturalized and US born, are much less likely to live in extremely overcrowded housing conditions, 5% compared to 12% for non-citizens in general. And naturalized citizens have, for poverty rates, they have the lowest poverty rate of all the groups, 15% compared to 19% for the foreign born. I mean, 19% for the US native born, sorry about that. Okay, next slide, please. Okay, we're gonna dig now into Brooklyn. Next slide, this is a map. The next slide shows a map of the Brooklyn community districts by number of non-citizens. There are 18 community districts in Brooklyn. Historically, immigrants have settled in the southern part of the borough, notably the large enclave of Russians in Brighton Beach, Community District 13 down there. Also in central Brooklyn, Community Districts 9 and 17, there's a well-established community of West Indians here. So those have been historic kind of enclaves in Brooklyn. But you can see in this map that non-citizens have a slightly different settlement pattern. In particular, Sunset Park, CD 7, and Bensonhurst 11 are emerging as homes to an increasing number of non-citizens. So we choose to focus on the 3 neighborhoods with the non-citizen populations that were most at risk of poor health outcomes. This should not obscure the findings that other similar neighborhoods are also at risk. And you can look at all the community districts and how they rank in our report that's online. Next slide, please. So Sunset Park and Windsor Terrace is the neighborhood that presented itself as the most at-risk neighborhood in Brooklyn. And it's home to the largest number of non-citizens in this borough as well. Over 42,000 non-citizens live in this borough. Next slide. The Chinese comprise 42% of this non-citizen population, followed by Mexico with 26%. So these 2 groups together account for almost 3/4 of this community district. And also I want to point out that Sunset has emerged as the 3rd Chinatown in the city. So it's a large Chinese community here. This neighborhood had the highest ranking for 3 of the 6 indicators. LEP, percent LEP, less than high school education, and percent undocumented immigrants. Over 1/4 residents in Sunset Park live in mixed status households. That's a household that has at least 1 undocumented immigrant. And in those households, 11,000 children are US citizens. Next slide. Bushwick, CD4, has a relatively smaller number of non-citizens. However, it ranked 2nd as being the most at risk of adverse health conditions. Next slide. The majority of non-citizens in this neighborhood are Hispanic, many of them from Mexico, the Dominican Republic, and Ecuador. Bushwick has the highest share of non-citizens without health insurance. The next slide, which is the 3rd neighborhood, which is Bay Ridge and Dyker Heights. This neighborhood is contiguous to and south of Sunset Park, and it's similar to that neighborhood in its large settlements of Chinese and Mexicans. Next slide. However, there's a slightly more diverse mix of immigrants in this community district from other countries as settled in this neighborhood as well. The majority of non-citizens speak Chinese, Spanish, and 10% also speak Arabic. This neighborhood has a disproportionate share of persons living in extremely overcrowded housing conditions. And it also has the highest poverty rate of all the CDs in Brooklyn. On the other hand, this neighborhood has relatively lower rankings for percent without health insurance and undocumented. And I want to just add one more thing here. This community district has a much larger share of naturalized citizens, implying that its foreign-born population has probably been established here longer. Next slide. So this slide puts it all in perspective. It shows the 6 health determinants for the 3 neighborhoods on the left. And then I've put on next to it naturalized citizens and native born for comparison. So you can see that while the 3 neighborhoods all have fairly similar looking profiles. When compared to the other two groups, the disparities are striking. So let's start with the dark blue bar on the left is the percent LEP, and you'd expect this to be high, particularly for non-citizens. The orange bar next is the less than high school degree. And this is where Sunset Park really stands out. 59% of this CD non-citizens do not have a high school education. The gray bar is the percent without health insurance. Again, this is highly correlated with the undocumented populations in these community districts, as most of them are not eligible for public benefits. And Bob, did you want to jump in here and say something?
Yeah, I just wanted to make a brief remark before you move on to Queens. I think this graph is really the heart of this report, because what you see is the 3 CDs that we chose as being most at risk. You see the bars are really obviously higher than the native born and higher than the naturalized citizens. But the other thing that I noticed was that for the 3 boroughs CDs that we chose, the highest bars are the blue, the orange, and the gray ones. And those are limited English proficiency and less than high school and no health insurance. Those are things I guess you could say, those are things that we could do something about. I mean, poverty is very difficult, overcrowding is very difficult. And not that any of these aren't difficult, but for anyone wanting to start programs to make improvements, those would be 3 places to look at. And I think with that, we can move on, Vicki.
Okay, thanks, Bob. Okay, next slide. So next we're going to jump into the Queens neighborhoods, and you can now go to the next slide also. And this is a map of Queens. There are 14 community districts here. So immigrants have long settled along the 7 train, also known as the International Express. That's also where you'll find large numbers of non-citizens as well. And so the 7 train kind of goes right through, the CD 2, 3, 4, and ends out in Flushing in CD 7. So that's the famous 7 train. Next slide. We found the most vulnerable neighborhood in Queens to be Elmhurst in South Corona, CD4. My arrow kind of didn't work here, but it's CD4 there, kind of in the middle. Next slide. So 63% of this community district is foreign born. The top 5 countries are Ecuador, Mexico, China, the Dominican Republic, and Colombia. About 19,000 non-citizens lack health insurance, the majority of whom are undocumented. This community district ranks the highest in Queens for percent living in overcrowded households. And 84% of non-citizens in this neighborhood work on the front lines. And also this has been one of the hardest hit neighborhoods hit in the COVID-19 pandemic. Next slide. Jackson Heights is north of and contiguous to Elmhurst, South Corona. And like this neighborhood, it has also large concentrations of Ecuadorians, Mexicans, Dominicans, Colombians, and Bangladeshis. This CD ranks the highest for percent without health insurance and the highest percent of undocumented immigrants. Of the 25,000 non-citizens who lack health insurance, the overwhelming majority are undocumented. Jackson Heights also has considerably lower poverty rate than non-citizens in other CDs, which is interesting, especially when compared to Flushing, which has 22% and is the next neighborhood. So you can go to the next slide. So Flushing is the 3rd neighborhood. It's home to the largest number of immigrants in the city. 139,000 immigrants live in this community district. More than half are foreign born. Next slide. This community district has the largest concentration of Asians in the city. And there are more than twice as many Chinese immigrants living in Flushing than in the first established Chinatown in Lower Manhattan. The Asian immigrants in Lower Manhattan have lived in the U.S. relatively longer in Queens, so the Flushing neighborhood isn't as obviously as well established as the Lower Manhattan one is. This neighborhood also has the highest poverty rate in Queens, and also the highest percent that are LEP. Of the 60,000 non-citizens who have trouble speaking language, 72% speak either Chinese or Korean. Next slide, please. So here again, we did this bar chart for Queens, which puts everything in perspective. Here, what kind of jumps out the most is this 88% of non-citizens in Flushing who have trouble speaking English. That is quite striking. For educational attainment, the three neighborhoods all look pretty close, the orange bars, but it's widely divergent when you look at the comparison groups of naturalized citizens and native born. And this is also true for the gray bars, which is health insurance. And Flushing is a little bit interesting, is that it has a smaller share of people living in overcrowded housing, but also has the highest poverty rate. So that was somewhat interesting. Flushing, remember, is it's a geographically large community district. Okay, next slide. The recommendations continue onto the next slide. These are some of the key takeaways here. If there's one key takeaway, promote naturalization programs. The one key takeaway here is that legal status matters. In 2018, there were about 622,000 persons living in the city that were eligible for naturalization. So I know that there are many community-based agencies and programs in New York City that offer these programs, and they're doing really great work. So these programs should be supported and expanded to service all those eligible for citizenship. Also, health insurance is huge. It's one of the most pressing issues facing immigrants in general and non-citizens in particular. More than 220,000 New Yorkers are uninsured and not eligible because of legal status. Also, the next recommendation, outreach efforts should continue to inform immigrants of their eligibility for public benefits despite the fear of public charge. So for example, DACA and TPS immigrants are eligible for New York State Medicaid and should be encouraged to take advantage of that. We should also push and support legislation that ensures all immigrants, regardless of status, are eligible for the COVID relief funds that's currently in Washington. And also foster holistic approaches. We found there's intersecting determinants. The health determinants all are intersecting and they're correlated. So neighborhoods that are vulnerable to adverse outcomes. So for instance, different neighborhoods have different needs and different health determinants. So for example, in Sunset Park, there's a large number that don't speak English, and also don't have a high school diploma. So it would be great to think in terms of holistic wraparound programs that could tackle, more than one of these issues. And lastly, which is always the last, more research is needed. I understand that, asking about legal immigration status in a healthcare setting is very sensitive. But I think that it's important to think about proxies that we could use, where we could glean information that could end up in getting better ideas of, at least citizen, non-citizen. And in this way, we'd be able to help better these vulnerable populations. And in particular, this is super imperative at this time in this pandemic that we're going through, and seeing that the immigrants are the ones that are kind of shoring us up, but also being hit the hardest by this pandemic. And that wraps it up for me. And I'm going to turn it over to Bob, and he's going to talk a little bit about he's going to lead into the data tool.
Okay, I just had a brief comment here about the data that are in the data tool that Danielle is going to introduce. We compile data, as I said before, we compile data for legal non-citizens and for undocumented, but we don't show any data in the data tool for the size of the undocumented population. And that's a variety of reasons, but we didn't want to take a chance on that being used for an enforcement tool, for example. But we don't show any numbers. And the reason I'm making this comment is that we show a lot of information on percentages of undocumented immigrants in the data tool. For example, when you download one of the Excel files, you can get information for the undocumented population on educational attainment, unemployment rate, median income, percentage below poverty, household characteristics, and health insurance. So you won't find numbers of those, but you will find percentages. You won't be able to manipulate the data, the percentages to get the total population, but at least you can see the percentages in each of these characteristics. So, and I want to point out too, and I'm sure Danielle is going to, that these detailed spreadsheets have information for all 4 boroughs, not just the 2 that Vicki talked about. And we left out Staten Island because there weren't really enough immigrants. And I think with that, I'll just turn it over to Daniela.
Thank you, Bob, and thank you, Vicki. So as part of this project, Vicki, Bob, and the rest of the CMS research team developed a data tool that serves as a complement to the report. The tool was created to help healthcare providers, government agencies, and immigrant serving organizations to understand and visualize the characteristics of vulnerable immigrant communities in New York City and identify potential gaps in their services to these communities. The tool assists with questions about healthcare, housing, legal, educational, and work-related services. As Bob and Vicki mentioned, the CMS team used data from the American Community Survey to arrive at these estimates. And the estimates in the tool are based on ACS files for the 5-year period from 2014 to 2018, which produce more reliable estimates at smaller geographic areas. The tool shows data at the city, borough, and community district level. And for this study, we used detailed data collected in the ACS for New York City's PUMAs, or public use microdata areas, which closely aligned with the city's community districts. Keep in mind that the values that are less than 500 are omitted in the data tool. Also, as Bob mentioned, due to privacy and security concerns, only the percentages and not the numbers of undocumented immigrants are disclosed in the data tool. And for certain areas, as you heard before, the number of legal non-citizens and undocumented immigrants are aggregated and presented as non-citizens. So with that, let's go through the data tool. So to access the data tool, you can visit our homepage, cmsny.org. When you scroll down to the data section, you can click on the New York City map, which will take you to the landing page that lists information that I just provided, as well as the data tool itself. This tool can be displayed in any browser, and it's best displayed on a desktop or laptop. And you can view the data in 3 different ways. First, as Bob mentioned, you can download the data on an Excel file. So let's say we want to see the file for Queens. You can download the file on your local disk, and I will now share what the file actually looks like. So the first tab, the first worksheet in the file includes a guide that lists each one of the community districts and their corresponding PUMA numbers. You can see that the file contains multiple worksheets. The first one will be with New York City estimates, followed by numbers at the borough level. So in this case, Queens, and then tabs for each one of the community districts. So if we'll take a look at the numbers for Queens, as Bob mentioned, the tab includes estimates on the health indicators by immigration legal status. You'll find the percentages for the native born, naturalized citizens, legal non-citizens, and undocumented. Also, the indicators are organized by social indicators, economic, housing, health insurance, and other health-related indicators, and finally, immigrant-related indicators. And you can find this information for each one of the community districts. So now let's go back to the data tool itself. You can also view the data as an interactive table where you can select the desired borough. So we have Bronx, Brooklyn, Manhattan, and Queens. Also, you can select the immigrant group that you look to query, either naturalized citizens or non-citizens, and the different variables of interest. These variables include area of birth, poverty status, which lists individual living below the poverty line, the 10 top countries of birth for the foreign born in New York City, the number of persons living in mixed status households, age, the number of essential workers, ability to speak English, the number of people who speak the top 5 languages of the foreign born with limited English proficiency, people with less than a high school diploma, estimates by race and ethnicity, and persons with no health insurance. So let's run a query. Let's say that we want to know the number of naturalized citizens without health insurance in Queens. Select Queens, naturalized citizens, and no health insurance. And we can see that 40,300 naturalized citizens in Queens do not have health insurance, which represents almost 7% of the entire naturalized citizen population in the borough. Also, at a quick glance, we can see that the highest numbers of uninsured are in Flushing, Jamaica, and Richmond Hill. Now let's say that we want to know the number of non-citizens in extremely crowded households in the Bronx. We'll select the Bronx, non-citizens, and persons in extremely overcrowded households. And we can see that 40,600 non-citizens live in extremely overcrowded households in the Bronx. That is 16% of the entire non-citizen population in the Bronx, which is higher than the number for the entire city. Also, the highest numbers at a community district are in Concourse, Morris Heights, and Bedford Park. Now let's take a look at the third way to view the data. You can select, which is the map view. The map view has a similar format as a table function. You can view the data either for naturalized citizens or non-citizens. The variables are exactly the same. And this map illustrates the percentages of a given indicator within and across boroughs. So for instance, if we want to know the highest percentages of non-citizen essential workers in the city, we can select non-citizens, essential workers, and we can see that the highest percentages are in the southern areas of, well, across the Bronx. In Queens, we find the largest percentages in Jackson Heights, Corona, Sunnyside, Bayside, and Far Rockaway. And in Brooklyn, they're in Bushwick and East New York, as well as in the southern part of Brooklyn. Now, if we're interested, let's say, in finding where Asian non-citizens reside, we can select non-citizens, area of birth, and Asia. And we see that Asians live largely in the eastern side of Queens, the Lower East Side of Manhattan, and parts of in the south of Brooklyn. As you can see, if you hover over the community district, you will get the count and percentage of that particular group that you're looking up. So for instance, we can see that 57,400 Asians live in Flushing, non-citizen Asians live in Flushing, which represents 84% of the entire non-citizen population in this community district. So with that, I will conclude our demonstration, and we hope you find this tool helpful in your work. Father Patrick, back to you.
Thank you, Daniela, and also to Vicky and to Bob for your presentation. We have some time for a little discussion and some questions. What I'll do is I'll read the questions and I'll pass them off to Daniela or to Vicky and to Bob. One of the questions that we see is the ACS is a great data source, but we know that non-citizens, particularly those undocumented persons with limited English and new immigrants, are often underrepresented. How may that affect your findings, and how does the American Community Survey ensure that the representation of these marginalized groups?
Yeah, I'll attempt that one. It is true that undocumented immigrants are underrepresented in the American Community Survey. We make an adjustment for undercount for undocumented immigrants. And the adjustment for undercount is based on how long they've been in the US, because we have very detailed statistics on year of entry. And for example, the undocumented immigrants who arrived most recently get an adjustment for undercount of about 15%. And that percent declines for length of time in the country. So when you get all the way back to 1982, there's only about a 2% adjustment for undercount. And we think that these adjustments are adequate because when we compile data, for example, for DACA, our estimates of people who were eligible for DACA are actually higher than the number who came forward. So that's one check on the adjustment factor.
Thank you. One of the parts that I also found very intriguing and was one of the questions is essential workers. And could you just expand upon what your definition of essential workers were?
I can take that one, unless you want to, Bob.
No, thank you.
It's easy. We used the executive order, New York State executive order that came out early.
Okay.
Yeah.
Thank you.
The pandemic, yeah.
Did you come across communities of Haitian origin in the community districts in Brooklyn and Queens? And are you able to see in the CDs by the country of origin in the data tool?
Yes, Haitians are part of that big West Indian population that I was pointing out in central Brooklyn. Haitians will show up. There's in the data tool, you can see we put out the top 5 countries of birth for non-citizens for each community district. So you can cruise through that data and see where the Haitians show up.
Okay. One of the questions is, even though the data can be very useful to address the needs of underserved non-citizens, there's always the risk of the same data being used to stigmatize the population. Do you have any suggestions to protect this vulnerable population?
Bob?
You know, to be honest with you, I'm not sure that over the last 4 years, the population could be stigmatized any more than it already was. I think that basically this data is useful for improving the conditions of the various immigrants, and I doubt seriously whether it'll be used in any kind of negative way.
Okay.
I'd also just like to say something on that. That's always a really fine line. And I've been in this situation before. You know, it's you in order to provide services, you've got to know, you know, who's most at risk and where the disparities are. So I would say that it's important to think about how the language is used around it. And yeah, and like I'm saying, like this report is mostly for, you know, for service providers and researchers, that they will be able to use this and know where to zero in on what neighborhood and what the needs are in that particular neighborhood. If that helps answer that question.
And just to add something else, I think the tool can also serve policymakers and those agencies that are tasked with protecting communities. We're seeing an increase in the number of attacks against Asian immigrants or Asian residents in New York City. So I think one potential use of this report and the data tool is to allocate resources accordingly. And also it's true that certain immigrant populations are difficult to access due to stigma in their communities. So this tool can also serve, help those providers understand where those communities are located and maybe think of innovative ways to reach those communities.
Okay. Thank you. One of the next question is, do you have any thoughts on how the report and the data could help affected communities in New York City better access to COVID-19 vaccines?
So, yeah, I mean, the Department of Health has been putting out pretty regularly by zip code all kinds of metrics on testing, deaths, and now vaccine rollout. They don't have that data by, again, they don't ask it for, you know, legal status is not collected for good reasons. But if you map that zip code map onto the maps that we just had, it's really easy to see, like Elmhurst, Corona. These are the neighborhoods that have been the hardest hit. So I would say the first thing, you know, you want to do is zoom into those neighborhoods. And they also don't have health insurance. A lot of these are undocumented immigrants and don't have health insurance and maybe not know that, you know, that it's free to get testing and the vaccine's free. So those are just some of the ways I could think, you know, that would be ideas.
Okay.
I would add that I believe that on the spreadsheets, we have age distributions, and I'm not sure, I should remember this because I worked on it for so many months, but we may have like age 65 and over. And you could look at each CD and see where the largest numbers are and make sure the vaccines have gotten to those places.
Okay. Another question that's just recently come in is, what would be needed to create a singular data or mapping tool for the whole country? Someone noted that it'd be very useful for CBOs working with migrants. So I think the obvious thing is money, of course, because
how much money do you have?
Let me respond to that one. I'm far too old to consider that because it would take a long. We worked pretty well full time for about 6 or 7 months on this data because it's there's really a lot of data involved here. I mean, it could be done, but we haven't really considered that yet. I guess if someone really wanted it badly enough, we would give it a shot.
Okay.
I would say that it might make more sense to do cities, you know, like
metropolitan area.
Focus in on cities. Yeah. The whole country would be slightly unwieldy.
One of your recommendations, you know, you talk about naturalization and how that greatly affected, when you see the data, it was quite striking. The impact naturalization, I don't think sometimes people think of citizenship as having that big of an impact on the social determinants of health. This is something, one of my questions. And looking at the data, you know, was your data source, and I don't know, you know, to show the change when, you know, immigrants naturalize, because, you know, you look at the statistics in terms of the undocumented versus those that are green card holders. Is there any suggestions that the data suggests that can encourage people to naturalize besides just become a citizen?
But we've seen in other reports that CMS has published that in general, people are better off with as they increase in status, as they become LPRs or as they become naturalized. And yeah, clearly there are advantages, and I think some of our graphs show that. But I would also point out that outmigration is higher for undocumented residents. And so there's some selectivity there. They tend to leave the country more often, for example, than legal permanent residents. And the naturalized population is generally better off, partly because they've been here for more years. Okay. So all of those factors are working at the same time. In general, and I think some of these graphs really show it though, improving the status of all foreign-born is a great plus.
Especially when you saw, at least when I saw the dramatic change between those naturalized and the other categories, especially some those three regions in Brooklyn, three in neighborhoods in Queens, it was quite stark, I think, or striking, I should say. And sometimes I don't think people think about health and citizenship or naturalization in that same category. Another question that recently—
Can I excuse me, Father
Sure.
Patrick? I just want to answer Leah's question real fast about Mexico. This is an easy one. Yes, Mexico is included in North America, not Latin America. That's a good question. And also one more, I do think I misspoke on the executive order, because I do think that it's the executive order that came out of Department of Homeland Security. Right. And I mixed that up with, because we also have it for the state's executive order. So in our report, you can go to the, there's a link that will take you to that. So sorry for that. That was false information.
Okay. Another question that's come in is, have you collaborated with CBOs in Queens or Brooklyn that work with undocumented immigrants or undocumented persons? And have you made the recommendations to them based on this report? And I think that's part of what today's presentation is about for that question, but I wanted to make sure it was raised and just, but you know, for maybe for Daniela or Vicky or Bob, for other CBOs, what ways could they be using the tools and the reports?
So I can just shout out here to the city's mayor's office of immigrant affairs. They work closely with CBOs. They have great relationships with them. So I am sure, you know, that's a good avenue for that. And then also I'm hoping that some are on this call right now. Does anybody else want to add to that?
Yeah, and part of the outreach, because the project does not end here. We still need to make sure that the report and the data tool get to the right hands. So we are making deliberate efforts to make sure to target our efforts to make sure that these two resources get to the hands of program staff, advocacy groups, and anyone who serves and works with immigrant communities. So that's absolutely an important part of the project.
Okay. And Danielle, I'm sure if people that are on this webinar, if they have questions, they can reach out, just go to the webpage for the Center for Immigration Studies. Is there any other, if they have questions?
Absolutely. You can reach us at cms@cmsny.org. If you have any inquiries or specific questions about the tool or the report, please let us know. So cms@cmsny.org.
Okay, we're getting close to the end, but some more questions are coming in. So if you do have them, please ask. One of the questions is, some groups are also eligible for the New York State health insurance, the Child Health Plus, and for children under the age of 19. How can this data be useful to promote health insurance access among uninsured immigrants?
Okay, I can take that one. Did this come in? I saw this question. Susan, yeah. Susan, you're right. And I did point out that, you know, undocumented immigrants there are some Medicaid programs they're eligible for, and you're correct. Children under the age of 19 are eligible for CHIP, which is a New York State Medicaid program for them. And that's regardless of legal status, and also WIC, pregnant women and young children, regardless of legal status. You'd be surprised at how many undocumented children under the age of 19, however, are still not insured. So that's clearly a population that should be, you know, looked at more closely. And so that's about outreach, and again, just promoting information about that, you know, your children are eligible for this, sign them up. So that's just on the ground hard work.
Just conscious of everyone's time, I do just want to once again just thank the Center for Migration Studies for putting this report, particularly to the co-authors, to Vicky and to Bob, to the tool that Daniela shared with all of us, and maybe just give you each an opportunity, just as we close, if there's a last comment you want to make. I do encourage you, if for those that are participating in this webinar, the report is available on the website, and it's an excellent report. And I do want to thank, having read it, and someone that's connected to immigrants, particularly in Brooklyn and Queens, and works with many different boards. This, I think, is very helpful and enlightening and very timely. And that's one thing. I think this whole report, I know the Center for Migration Studies started this before COVID, and it became so timely during this pandemic. So just to the co-authors, thank you, and to all the work that the Center for Migration Studies does each and every day. So I'll give everyone just one last opportunity, and just to thank you all for participating. And for those who were able to join the webinar, please look to the website for the Center for Migration Studies. There's a lot of information they put out. It's very useful if you're connected to immigrants and the cause of migration. So thank you to the Center for Migration Studies, and pass it off to the panel for closing comment. Okay,
well, I just wanted to say that my only hope and wish is that this is a contribution, and that it's useful. And it's been a delight working on this program with all the CMS workers. Everyone's been so helpful. It's been a great collaboration, and especially my trusty co-author, Bob Warren. So those are my parting comments. So you can talk next, Bob.
Okay, I want to echo that same sentiment that Vicky worked really hard on this project, and it was really a team effort by CMS, by everybody involved, and worked very well. And I just hope that it turns out to be very useful for everybody.
Yeah, just to echo those words, our gratitude to Vicky and Bob, of course, to the Mother Cabrini Health Foundation for supporting this project. And we hope that the data tool and the report will help immigrant communities who have been severely hit during the COVID-19 pandemic. We hope that the resources and the support that these communities need comes, and that these two resources provide some information and guide to optimize those resources. So with that, thank you so much. Back to you, Father Patrick.
Okay, and once again, just to everyone who participated, thank you for making the time. And as I said, the report and this data tool is very crucial at this time and very helpful. So to the co-authors, thank you. And to the Center for Migration Studies, to everyone who enjoyed, thank you. Continue to stay safe and be healthy.